When Mary MacKillop walked this earth, she was doing the work inspired by Jesus. She cared for the poor, the sick and the aged. Today, those of us who work in Catholic health and aged care services are continuing that work of Jesus and of Mary. But of course, today we operate in a very different environment to that which Mary MacKillop faced. Our world is complex. Our services are highly regulated. We're dependent on many external factors. Within that, there are many questions that arise for what it is to be a Catholic hospital, what it is to be a Catholic aged care organisation. So Catholic Health Australia has produced this material to support you in your work as trustees, as directors, as senior leaders of Catholic health and aged care services today. We hope that Mission in Focus will enable you to unpack what it is to provide the continuance of the healing ministry of Christ in a complex world today. So we hope that you will use these resources around your boardroom table, around your executive table, to consider and reflect on your role as stewards of the ministry of the Church in health and aged care. We hope these resources challenge you. We hope these resources answer some of your questions. We're grateful that many members of the Catholic family from both Australia and around the world have contributed to developing Mission in Focus. We hope you're able to deepen and enrich your understanding of what it is to continue the work undertaken by Mary, inspired by the work of Jesus.
I'm really excited about the transition from religious men and women who ran these health and aged care facilities to now handing over and partnering, still partnering with, but handing over to lay leadership of our institutions, particularly in health and aged care. I believe we need to use very explicit and intentional language when we are working with our lay partners. When in religious life we talked religious talk, today some of that still exists and needs to exist, but we need to be able to communicate freely with our lay partners, and our lay partners understand and work and communicate freely with us. So I think we've got to be very particular about how we do that. So how does a Catholic service have confidence that it is authentically Catholic? I think the first issue is that under canon law, the bishop of the diocese has to approve the development of a Catholic hospital in its diocese. There should be very close cooperation and communication between the bishop and the senior people in the facility, the board, whoever the governing body is. And I think it's really, really important that the bishop never kind of hears about that place from a third party. They will get third party people, but we need to keep the communication so good that the bishop would pick up the phone to us when there is an issue, if there is an issue. Well, let me give you an example of that. We conduct a women's hospital, tertiary women's hospital, and we have an obligation, I believe, to present to the bishop regularly, to brief the bishop on issues pertaining to the clinical care and often research that is conducted in that hospital. The bishop should never get a surprise about things that are going on there, and we have an obligation as experts in the clinical and scientific area to educate our bishops in new thinking and what is going on. I think that is really, really important. Another way we express our faith is the opportunity for our patients and residents to have access to the sacraments, to pastoral care, to the support of pastoral care within our institutions, and to help those patients and residents make sense of what they are going through, be it in a hospital or be in an aged care facility, and at that point in their lives, particularly in aged care when they are really challenged to know what their next steps are. It's a very confronting time, and you would want the Church to be very much part of that for those people. Another dimension that we need to address is the whole question of ethics, and part of that is is making sure our staff have every opportunity for education, to have every opportunity to discuss ethical issues that they see arising in our care. CHA's Code of Ethical Standards is a very good starting point for our people. They're encouraged to use that document, to be very familiar with it. It's freely available in the facilities, and I think that's a very important part of their development, and familiarity and comfortableness with the document and with raising issues that are of importance to them. Education of our people is another vitally important part in this particular area of ethics. It's a constant challenge because the turnover of staff is such that it just goes on, and you get one group familiar with it and then you start all over again. And that's particularly of concern in aged care, where the turnover of staff there is very, very frequent. So I think we've got a real obligation to just continue to teach, to be available, and to encourage questioning. As a Catholic organisation, there needs to be a really strong emphasis on formation. Formation of our leaders in particular, but of all our staff where it's possible. We need to be unashamedly Catholic. People come to work with us, they know we're Catholic, and they are more than prepared to take that responsibility. But we in Catholic Health have a real responsibility also to make sure that those people, those lay leaders, are supported and encouraged to continue our Catholic ministry. And my experience is they really take that very seriously and wouldn't be working with us unless they did. We need, I think, to really articulate in our policies and our procedures and our practices what that Catholic vision is. And it's very, very important that our people sign on to it and understand it. And so we have a real responsibility to translate that into language for them today and encourage them to practice it. In our Catholic facilities, very much part of what we do every day is the business end, and I think that is a very important way of demonstrating what we're about. If we look at budgeting, for example, and it's budget time, we need to look through the lens of Catholic, we need to look through the lens of mission, and make that very tangible to our people as they do address the business end of the organisation as well. I think this is really, people would say this is where the rubber hits the road, because we can talk mission and be very comfortable with that, but it's when you start to talk business, budgets, end-year results, you need to look at all of those through the lens of mission. What we're doing is about mission. Sure, we have to have good business structures, but we also do it through that mission lens. And I think that's always a challenge, to make that really, to have it addressed in the first instance, but also make that part of what we're doing. The Catholicity of our facilities is very apparent, I think. The days of having lots of religious women and men in our facilities are gone. Whilst there are not the sisters obviously present there anymore, our facilities are, I think, as Catholic as they ever were, and in fact the onus is really on our lay people and the sisters that are still working in the facilities to continue that Catholic ethos strongly throughout the institution, and they do. People say it is different, and it's not the presence of nuns anymore or religious women, it's the presence of committed people who are living the mission and the ethos and the values. I think it's an exciting time, and they will, and this opportunity will take us further into new opportunities, and I believe Catholic health is alive and very, very alive and well.